Well, today's everyday hero is one hero among many. As Director of Adult Critical Care at Oregon Health Sciences University, Christine Bartlett had barely settled into that role when the coronavirus pandemic began. And since then, her clear communication skills and positive managerial style has struck a chord with frontline healthcare workers at the hospital. Last February 28th, a Friday, Christine Bartlett was at the gym when her phone rang.
And they said, hey, we have our first positive case and we're opening our emergency operations center and we need you to come in and be the planning chief for the hospital. And I was like, oh, okay, do I have time to shower?
OHSU is just one of two level 1 trauma centers in Portland. It was Christine's job to get OHSU ready for the coronavirus. And that was on top of her regular job, overseeing 16 lead nurses and 350 frontline staff.
We didn't know a lot in the beginning. You know, we were trying to see what was happening from China. We were trying to see what was happening in New York. We were watching what was happening in Seattle. And we thought, we are Oregon's academic medical center, and we have to be the leaders in this.
Bartlett realized they would need 50 more ICU beds and find the nurses to staff them. ICU and emergency department nurses were in high demand around the country.
So we never got the surge, thankfully, you know, because that's people. That's people that are staying healthy and following the guidelines.
Dr. David Zones, Associate Chief Medical Officer at OHSU, who works closely with Bartlett, was impressed with how she took over the job. She gave nurses and staff a morale boost from day one.
She took the leadership role in that unit and really brought up and sort of raised the boat of everyone, the optimism, the ability to care for really challenging patients.
Bartlett said the attention and adulation showered on nurses at the beginning of the pandemic was uplifting.
We had food, 3 meals a day. We had wine from the wineries. If you were over 21, you could come get your wine. We had gifts. We had people sending cards.
Now the outpouring of praise has faded.
And now we're in the long haul, right? People are getting tired of wearing all of the isolation garb, and people are getting tired of not being able to hug each other.
But her embrace of the nursing staff happens every day.
We recognize what they're going through every day to have to wear that isolation gear for 12 hours a day, you know, to have those deep creases in your face from your masks. And they are our heroes.
The collaboration between doctors and nurses is crucial, Bartlett said, because doctors have one view and nurses tend to have another view. So having both views on how to handle critical care is, in her words, super important. You can find out more about Christine Bartlett and her team at OHSU on our website, KATU.com.